Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center in Des Moines, Iowa, and I'm also the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. Tonight, our guest is Lori Pietig from St. Anthony Regional Hospital in Carroll, Iowa, where she is the Director of Cancer Services. Welcome, Lori.
Thank you.
How are things in Carroll, Iowa today?
Well, a little less windy than the last couple of days, I can tell you that.
You didn't have any tornadoes yesterday, did you? I hope.
Nope, all of that was north of us. We were blessed with some rain though, and we will take it.
And Lori, what would you say is the claim to fame for Carroll, Iowa?
I would have to say is everybody knows somebody from Carroll.
That is right. My grandpa and grandma actually lived in Carroll, Iowa for a time. So that's Carroll. I think other famous things, you might not think of it as famous, but I know that Carroll is near Templeton, right?
You are correct.
Not too far. How far is Templeton?
About 15 miles.
Okay. So we'll leave it up to people to investigate why Templeton is famous if they don't already know.
Yes.
So what about you? Where are you from originally, Lori?
Well, I actually was born and raised in the Carroll area. I grew up on a farm just south of Carroll in a small town called Roselle, Iowa, which has got the same population today as it did 27 years ago. It's a place I was happy to grow up in. But I went to high school and had all my education here locally in Carroll.
Okay. What was your claim to fame in high school?
Oh, boy. That's a tough question. I did a lot of art. I was very active on the dance team, and I proceeded a lot of pottery and a lot of art classes. If art has made money, that maybe have been my path in life.
And what did you do the year you graduated from high school?
When I graduated, I ended up moving up to South Dakota and went to USC for a year thinking I was going to be a veterinarian.
And then where did your path lead you after that?
It ended up taking me back down to Omaha where I had some family and went to Clarkson College, and I figured out that veterinary school was not my path. Too many years, though I ended up going that long anyway, but ended up in x-ray school where I could use my creativity and sciences all in the same path of healthcare.
And then how did your radiology, so you had a career as a radiology technologist, and did you work in a cancer center as a radiology technologist?
No, my path took me back home to Carroll. My very first job out of college was coming back home. There was several positions open, and my high school sweetheart was still here, so I naturally kind of came back this direction. And there was no jobs in Omaha. At that time, it was very saturated. So I thought I would stay out there for a little bit, but ended up coming back to Carroll. And here I am 20 years later.
And how long have you been the Director of Cancer Services there at St. Anthony Regional Hospital in Carroll?
My position, I took it on only 4 years ago in June. So still pretty new. It was a brand new role within the organization. So walked into a position that had a job description, but really no direction.
Well, that's exciting and a little scary.
Yes.
And what was the position you were in immediately before taking over as the Director of Cancer Services?
I had been our Director of Radiology for 7 years. I started as a staff tech, worked my way through learning different modalities, went back to school and got my master's degree so I could pursue administration and leadership. And that took me to the opportunity within the cancer services line, which I had a lot of interaction already with the patients, the physicians, the staff, just in a different way.
Yes. So the topic tonight is really talking about cancer in Iowa as it pertains to smaller cities and basically rural Iowa. And one of the benefits and disadvantages, depending on how you look at it, is that everybody knows everybody. You're a fairly, I've had the opportunity to tour your cancer center, your hospital, and everybody who works in the hospital pretty much knows everyone, and many people have been there for many years, and you have the opportunity to develop leadership roles in an institution like that.
Absolutely. And I loved the ability, especially being the director of the radiology department. Our referring providers, I had a great relationship with them. If we had a question, if we thought maybe the study that they ordered wasn't going to be maybe the appropriate study, we would work with our radiologist. I could call that doctor up and they would feel confident in the conversation. We would make those decisions and proceed with the best patient care.
So describe for us the cancer center there at St. Anthony Regional Cancer Center. What are the various components, and maybe give us a feel for the staffing in terms of the type of staff and number of staff that you have, and then also the number of patients that you serve.
Well, the center itself, we opened a brand new building a little over 3 years ago, and it was a huge endeavor to take service lines we already had within the hospital and reinventing what it's going to look like for our facility moving forward. We have a medical oncology department, and we partner with Mission Cancer and Blood, have several staff that help support the service line on the medical oncology team. When we moved from our current space into the center, we were seeing patients in the medical oncology clinic about 3 days a week, and our patient volumes have grown so much that we've extended up to 5 days a week. Our infusion therapy department is 18 chairs. I didn't think about that. Sorry. That we are full on a regular basis, and they partner closely with our medical oncologists. But we also do all of our specialty infusions. We do blood transfusions. We do antibiotics, different types of supportive drugs outside of the chemotherapy realm, supporting the community in the center as a whole and the facility as a whole. And then our radiation oncology department, we've got 2 therapists, a full-time nurse, dosimetrist, and physics all on site that work closely with our physicians and staff to provide care. And we have patients that cross over between both medical oncology and radiation oncology, and that's really special for a community center to have both service lines and physicians that can work together.
Right, and in the same building as you develop this center where every truly patient-centered, and they park once and they're in the cancer center and can see the medical oncologists, radiation oncologists, and get both treatments.
Yep. And we worked on expanding our support services too, social services, nurse navigator, dietitian. Those were pieces that were called upon if needed instead of being part of the day-to-day conversation. With opening the center, we wanted to look at a more comprehensive model and how we bring all of those services together under one roof at all the same meetings, having the same conversations, and the patients get to meet them throughout their journey.
How many patients do you serve per year in your cancer center?
Last year, we had over 15,000 patient visits and close to almost 500 new patients through the door. And that covers radiation, medical oncology, both, and some are dual. But
Yeah, so about 500 unique patients in a year.
Mhm.
And with those 500 patients, about 15,000 different services that they might get in a year.
Yep, and those are our new patients, not the current patients that are continuing their visits and treatments.
Coming back for follow-up. What is your primary service area geographically?
So we cover all of West Central Iowa. We cover 17 counties is where our referral base is. Carroll County proper and the surrounding counties, which are 6, there's 6 counties that touch Carroll County, is where the bulk of our patients come from. But we've gotten patients from up to 90 miles away and actually from different states because they're moving to where their support system is. And then we help coordinate that care.
What center with radiation is closest to you geographically?
Ames would be the closest at about 60 miles.
60 miles away. Okay. So obviously, even though, what's the population of Carroll as a city?
Carroll as a city is just right at 10,000.
Okay. But because of the fact that there are not other cancer centers close by, you have really take care of Carroll County and the 6 surrounding counties.
and beyond.
Okay. What would you say are some of the challenges of being in a center? So you have one machine, radiation machine, one radiation oncologist. You've got medical oncologists that are coming from Des Moines to support you, but now you have somebody coming once a day, really 5 days a week. What are some of the challenges of providing comprehensive cancer care in a community the size of Carroll?
So one of the biggest things that we face is the distance, the patients coming from so far away, trying to collaborate with their PCPs that may be several counties away and actually practice out of a different facility. We have a lot of supporting hospitals around us, 6 total, within a 30-mile radius. So we work with those providers to look at a collaboration of care for our patients, whether they need to get some support services back at their home base. It could be fluids and their local infusion departments, but then they're coming to us for chemo and their radiation. It's a collaboration. And the distance does propose challenges because we don't have public transportation that's readily available. And it's getting those patients from point A to point B to help continue their care and their treatment.
Mm-hmm. What are some of the benefits of patients getting cancer care in a community hospital such as Carroll?
You walk in and you know the face every day that you're going to see, and you know the team that's going to be working with you. We have such a wonderful tenured staff that is committed to the organization and the service line and the patients that we serve. They become our family. We had this sweet little lady one day, and she was in the nursing home, and she did not want to finish her radiation treatment, which is a terrible thought. But she got to come out every day and see people and talk to people and build relationships. And those are kind of the moments of we do make a difference every day. We're not only treating cancer, but we're working with our patients and giving them hopefully a better quality of life too.
Mm-hmm. I would imagine that although you have many, many services there at Carroll, you might not have some of the surgical subspecialties, and you probably cancer care at larger hospitals, whether it's Omaha or Des Moines or University of Iowa or Mayo or Sioux Falls, where they might need to go for some of the more maybe specialized surgeries.
We absolutely do collaborate with all of those organizations, and we know what we're really good at, and we know what we need a partnership with. And our patients sometimes get to choose the path of which direction they go, depending on where they live within our area. Some may prefer Omaha, some may prefer Iowa City or Mayo, and like you said, Sioux Falls, because we do have some people from the northern market. And how do we work with the patient and those teams to get that care, but then get them back closer to home and make sure that we can support that treatment plan. And our physicians work closely with other facilities, working with those doctors in collaboration of care to get that patient the care that they need.
What are some of the other organizations that provide support to you as a cancer center or to your patients? And I'm thinking of, organizations like American Cancer Society or Iowa Cancer Consortium or Above and Beyond Cancer, or what are some of the other organizations that you collaborate with? Or do you have also some homegrown cancer organizations that support your patients and your organization?
We have been blessed with all of the above. The Iowa Cancer Consortium has brought grant opportunities, additional resources, education. I am very thankful for the opportunity to partner with them and sit on some of their committees. Above and Beyond Cancer, we've been able to get some of their hotel resources for our patients that live long distances. We've got a huge community support. It's not uncommon for me to have a group of kids come out front and drop off their lemonade stand money to buy snacks for our patients. We've got an organization called the Super Draft that is a softball tournament that makes a donation back to the center every year that helps with those one-off patient needs. And all of our local organizations, the Lions Club, the schools, do donations all the time, whether it's cards and blankets, gift baskets. We are truly blessed by the support of our communities that we can give our patients. And I love sharing the stories.
Yes, I've had an opportunity to talk at your cancer center events that you sponsor for your survivors. And Carol is just noted for being such a outgoing, philanthropic, supportive community, and from a financial point of view, and also, just that neighborly help another neighbor in need.
And the American Cancer Society and the Relay for Life has really been pivotal in some of the community events, but also some recent grants that we've gotten for gas cards. Because we don't have public transportation readily available, the gas cards are what our patients need to get to care because they're on the road. I had pulled together one of our prostate cancer patients that lived 30 miles away. And through that course of treatment, they put on over 3,000 miles on their car going back and forth for radiation and supportive care. And those gas cards make or break the patient sometimes on their ability to get here.
Right. What keeps you up at night? What do you worry about? As it pertains to your cancer center.
Every day you hope the machines turn on when, we're lucky for new equipment, but assuring staffing and that each day we're going to be able to provide the best care possible to our patients. And we have patients that come with a pretty heavy load, and supporting the staff to take care of those patients and get through those journeys together, because the staff go through journeys with these patients too.
Mm-hmm. And one of the issues that healthcare is facing around the country, probably the world, but whether you're at a large city cancer center, university cancer center, healthcare personnel shortages of trying to adequately staff radiology technology, nursing, certified medical assistants, even receptionists. Is personnel and recruitment of individuals a challenge for you there in Carroll?
As the organization of a whole, yes. We have seen the challenges, especially in the 24-hour departments, trying to get staff to stay and tenured staff. And some departments have a harder time than others. Luckily, at the center, if I have an open position, it doesn't usually stay open for long. We have a positive environment, and the hours are attainable to staff wanting to work a Monday through Friday job. So at the center, we seem to stay fully staffed, but as an organization, we struggle like everybody else in certain areas.
Mm-hmm. How is your hospital doing in terms of nursing staffing? Do you have lots of open nursing positions?
That's always a moving target. We've got positions open across the organization, but they seem to be able to make it work with the staff that we have. Our traveling nursing is way down post-COVID. I know a lot of facilities were using a lot of traveling nurses to fill shifts and working away from that to find sustainable staff, value our staff, to give them an environment of what they're going to want to come to work at every day.
Recently, the Iowa Cancer Consortium and the State Tumor Registry put out the Cancer in Iowa 2024 report. The 2023 report, for the first time, Iowa became second in the nation in terms of incidence of cancer, second only to Kentucky. All of the other 48 states have a lower incidence, and in 2024, we're still number 2, but we're the only state that is increasing in incidence. So if nothing changes between Kentucky and Iowa, Soon, Iowa will be number one in terms of incidence in cancer. And there's been a lot of talk about what is it about Iowa that might be leading to our increased incidence. And some are speculating, one might be radon. We do live on a hotbed of radon, that's not a pollutant. It's not man-made. It's just natural in the way the glaciers carved out the geography and geology of Iowa. We have a lot of radon, but there's also a lot of speculation that because we have so many acres of land under production, that perhaps ag chemicals might be also contributing to this. Has that news of Iowa being number two in terms of incidence of cancer, is that something that your patients in your community is talking about?
Increase in patient referrals. So we're seeing the back end of what that study shows, and particularly like our head and neck cancers. Those patients were far and few between 10 years ago, and we are routinely treating our head and neck cancer patients, having a few under treatment each and every week. So whether it's not environmental, but the HPV positive is definitely something playing in the vaccination. Lifestyle choices. We like the sun and we like to have fun. So, how that plays in. But we also have our patients that come in with lung cancer that never smoked a day in their life. So does radon play into that? I think it's hard to pick a specific factor, more so than are we screening better? Are we diagnosing sooner? Is that helping increase those numbers? But how can we decrease those numbers on the back end too?
Right. And as you know, 45% of all cancers in the United States are really caused by things that we have the power to modify. So whether it is cigarette smoking, obesity, poor nutrition, physical activity, sun exposure, vaccinations for HPV, all of those are things that we have the ability to modify. We're still pushing for more research to see are some of the environmental things possibly modifiable, and can we mitigate some of our exposures that we get, not just to ag chemicals, but to PFASs and plastics and, plastics and carpets and upholstery and non-stick coatings. All of those things are potential carcinogens.
I just had I did presentations at our local high school. Their biology class, an advanced biology class, just did a chapter on cancer care. And I go in and I talk to them about rural health care, barriers to care. They talk a lot about genetics and all the different type of technologies, AI technology and things coming up in the future. But then I also started including what can they do to help decrease their risk. The choices we make at a young age are what we pay for 20 years later. Sun exposure, drinking, smoking, all of those things, exercise, obesity, those are all things I touched on with those high school students. Is being aware now is going to hopefully improve your health in the future.
Do you have tanning booths in Carroll, Iowa?
I think we do.
So girls are probably there right now getting ready for prom, right?
I've seen a lot more to the spray tan side of things. And
okay.
Whether that's any better, I don't really know.
Yeah, we don't know, but and the reason we bring it up for those who don't know is that the tan you get in a tanning booth increases your risk of cancer, and one of the real concerns is melanoma, that's skin cancer that can be deadly. And with the increased use of tanning booths, we've seen an increase in melanomas in younger, especially women.
Yeah, and our numbers in cancer diagnosis and rates are right in line, and what we're seeing as a center is what they're coming out in the Iowa Cancer Report. I mean, breast, prostate, lung, skin cancers, those are all of our top cancers that we see here too.
One of the things that we experience at every cancer center is psychosocial support. financial support, insurance. Are those, do you have on your staff social workers, mental health counselors, support for family members? How are you able to provide that psychosocial support for patients and families as they're going through the cancer treatment?
We do have a full-time social worker who we are so blessed to have, and she started with us about 18 months ago. She does all the distress screening up front with our patients and does routine check-ins. We have an in-person support group that we bring different community resources to, utilizing not only what we have within the organization, but what community resources. We've got Catholic Charities, different mental health clinics that we can refer patients to, along with their family members. If family members need respite care, if family members need home support, what can we do as a community to support those patients and their family? Sometimes for us, it's not caring for the patients more so than it is their loved ones, as they support the patient through their journey.
Nowadays, almost most types of cancer, we want to do advanced testing on either the cancer cells or what we call liquid biopsies. I imagine that your pathology department is very good, but you probably do rely on outsourcing some of your pathology. Can you comment maybe a little bit about how you at care at St. Anthony's handle the specimens and biopsies? Do most of those go out to specialty pathology departments? Do you do it in-house?
We do a combination of all the above. Our pathology team here and Dr. Hagen does some in-house, but we do utilize the facilities, university or Nebraska Med Center. I know that we do send some out that direction. 90% of our patients, though, usually come from outside of St. Anthony. So that information and those biopsy workups are happening prior to them coming to our organization. And then if there's any special testing that needs to be done, our medical oncologist will work closely with wherever the referring facility is to get the additional testing done on the biopsy. But also, if we're going to do genetic testing or any other workup outside of the initial diagnosis, we partner with different entities for that too.
Okay. What do you like most about, number one, your job, and number two, what do you like most about Carroll, Iowa?
Number one on my job is my patients and my staff. The patients give more to us every day than we could ever give to them. So grateful and thankful that they chose St. Anthony and they chose our team to take care of them, and the dedicated staff that show up each and every day and have been taking care of these patients. My clinical supervisor just retired and she was part of the organization for 42 years. So we definitely get a sense of community and dedication to the organization and the service line. And what do I love most about Carroll is it's my home. It's where I grew up. It's where I feel my heart is, and I want to continue to serve the people of Carroll and the community.
And if I had a grant to give you, and let's say it was $150,000 a year, and I told you I want you to hire someone with credentials that you don't have already at the cancer center at St. Anthony's in Carroll, what would you like to add on in terms of services that could be done at your center that you don't already have?
Oh boy, that's hard. You know, we've added so much over the years. You know, if I could have a van and a driver whose job was to go pick up our patients and bring them back and forth, and we didn't have to try to coordinate that, that would be awesome. That would really be awesome. a dedicated transfer van. But, you know, we have patients come from so far, we might only be able to do the southern market today and the northern market tomorrow.
Right. You can't send them out both north and south at the same time. I mean, a rural school bus kind of knows how to make a route, but even so, there's a limit to how much you can go in all directions at one time with one vehicle.
Yeah, barriers to transportation is probably sometimes our biggest hiccup.
Yeah. Is St. Anthony's considered a critical access hospital?
Right now, no. but maybe in the future.
Okay. And for those who don't know, Medicare has used the designation critical access for hospitals that are in very rural areas with, and they're rewarded with some extra compensation for the medical care. And so you're kind of on the bubble. You're just a little too big to meet their current qualifications, perhaps.
Yep. We are in that not sweet zone, but sweet zone.
Okay. We're going to open it up for questions. So we have a live studio audience here and then we also have those individuals that are watching us live streaming. So if you have questions for Lori Pietig, Lori is the Director of Cancer Services at St. Anthony Regional Hospital in Carroll, Iowa. We'll take some questions now. Here we go. Poon.
Lori, when you spoke to those high school students, did you talk with them about how important it is to get the HPV vaccine?
So that is something I did not touch on, and I didn't touch on it for a couple of reasons. I feel and value the importance of it. I led with the conversation of setting up an appointment with your healthcare provider, talking to your parents about what's going to be best for you at this age group, and having a good conversation with your doctor and having that routine care. I didn't feel I could answer their questions appropriately in that setting if they had it, and I wanted to make sure that they talk to their parents and their healthcare provider about that.
Lori, do you have a sense for what the HPV vaccination rate is in Carroll, Iowa, in your primary care community?
I do not.
Okay.
I could probably Google it.
So unfortunately, in all of Iowa, it's below average, and we're making a push for HPV vaccination. So for those that are watching, I wonder what we're talking about. The human papilloma virus causes 6 different cancers, and there's a vaccine that one should get basically between the ages of 11 and 13 that can prevent these 6 different types of cancer. And one of the reasons Lori is indicating it's a little sensitive to talk about is 5 of those 6 cancers are below the belt. So those cancers that are caused by HPV are cervix cancer, vaginal cancer, anal cancer, penile cancer, and vulvar cancer. Those are the 5 below the belt, if you will. And then oral pharynx cancer, or cancer in the region of the tonsil. Those are the 6 different cancers that are caused by the HPV virus. And now we have a vaccine. And so if individuals get vaccinated between the ages of 11 and 13, it can prevent those 6 different types of cancer. How in Carroll, Iowa, what would you say, if you know, or your impression of the use of tobacco, the use of vaping, alcohol? Is that, do you think you're average, above average, below average? What's the setting there in Carroll, and how are those substances kind of used in the community? What sort of resources are there to serve to mentor healthy behavior?
For tobacco use, I would say we are definitely with the average for Iowa. I would say that with the younger population, the vaping is probably on the rise, just from an accessibility standpoint and a way to hide it more so than what kids used to do with smoking. Alcohol use in our area is higher than the state average. I don't have those numbers in front of me, but I do know that we definitely are on the higher end of that.
Okay. We have some other questions here in the room.
Lori, are there any commonalities among patients that stay in Carroll and get their treatment regimen in Carroll as opposed to going somewhere else? And does that have anything to do with the regimen itself, how they're treated? And is income a role for people that stay in Carroll as opposed to going someplace else, as an example?
You know, the population that we serve is definitely on the elderly side. Our patients are usually in the retirement age, and sheer accessibility is one of the reasons that I hear from a lot of patients that travel. Highway 71 and 30 are very easy roads for people to travel, and our center is very accessible. Our physicians that we have here have been here for a long time, and we've actually seen multiple generations under our care. So they're comfortable with the providers and their ability to get to the center. They don't have to go on the interstate. They don't have to park in a parking garage. They pull right up. And continuing for that outreach, and our best referral sometimes is just our patients' experience. And them saying, I had really great care in Carroll and I would go back again if I had to. And we do get that a lot from our patients too.
And Dr. Deming talked about the surging cancer rates in Iowa, and there's some thinking that agriculture has something to do with that, and you're surrounded by it. I mean, you probably can walk out the door into a farm field, where you're at. Even anecdotally, do you see any evidence of anything having to do with the rural environment that's increasing cancer in your hospital among your patients?
It's an environment of which we live in. I don't have the information or the data to say this is increasing over the next. I do hope, though, that, our farmers, and my husband being one of them, are taking precautions to be safer in those environments. Just 20 years ago, people were out putting on chemicals and not wearing protective gear. Are we going to see those patients in the long run? Very well could be, just from their exposure. But I'm hoping now that there's better practices in place to do things safely, not only for the environment, but for their own health.
Just out of curiosity, Lori, has your husband taken more precaution over the last 20 years in terms of protective gear, as he is, actively engaged in a profession that does come into contact with chemicals?
They definitely are given better education and have to go through more training. So we've had instances in our family where people have had exposures that have been detrimental to their health, and whether it's anhydrous or a chemical exposure. So those are sometimes hard lessons learned, but the education and training that those applicators now have, definitely, I think it will help improve things in the future. Yeah. Now they got to follow through with it.
Yeah. But as you point, farming is a dangerous activity, not only chemicals, but just the machinery and, all sorts of things can happen in terms of accidents with machinery and animals and chemicals. So it's a dangerous profession.
It very much is.
Yeah.
In awareness, really working on just awareness of farm safety across the board is something we talk about on a regular basis.
I think we have another question.
Yeah. Carol was recently in the news, I believe, regarding the fact that you're losing so many of your young people in general, and it was hard to replace or find. It was hard to fill jobs, I think, was the emphasis. It sounds like you're doing fine because of your positive work environment. I guess my question goes into your area and also all the surrounding. I think you said 17 counties. You probably have an elderly population. That was one of the things that was referenced, was the fact that when you walk down the streets of Carroll, you don't see a lot of young people. You see, seniors. Now, does that lead into concerns with, taking a little more time to process a patient, because the elderly might need a little more help in registering that? And then the second part of that question would be, is insurance equally accepting of all ages, or are there any restrictions on elderly for the number of visits and that type of thing?
For our patient population, we definitely do see a higher elderly population, the age, but we really try to meet our patients where they're at. If they need our nurse navigator to be with them, we need to put a family member on the phone while we're having a consultation so they can hear what the patient and their family members is hearing. We really do try to meet the patients where they're at within their care and how can we support them in their care. Carroll, from a population standpoint, has stayed pretty steady over the last 20 years. We do have struggles with, we don't have a high unemployment rate in Carroll, but getting more small families or young families to come, that is a struggle everywhere in rural America, is how can we support families with education, low crime rate, childcare, and get people want to move to the area. As for insurance, that is a barrier of healthcare all of its own beast. It continues to be challenging from pre-authorization, limiting amount of visits, limiting testing, and that is something we look at with each and every patient. So having an authorization department that can work through the pre-auth, having support services available for those who may need additional financial support. We try to incorporate copay assistance to help offset the copays that patients may have. So we work really hard to really just look at each patient individually, because no one diagnosis and no one insurance is ever the same.
So, Lori, in terms of the population over 65, fortunately, Medicare is available to most of those. What we've seen recently, though, is almost 50% of people who are eligible for Medicare sign up for Medicare Advantage plans. And I truly don't think that they totally understand the difference between regular Medicare and Medicare Advantage plans. What have you seen in Carroll around individuals preferring Medicare Advantage to regular Medicare, and what issues have you as a health system experienced with some of the Medicare Advantage plans?
We are seeing the same trend. Medicare Advantage plans are becoming more and more prevalent with the population that we serve. Unfortunately, with that, we do have a lot more hoops to jump through in order to provide care. So authorizations can be delaying to care. We have to use particular type of preferred drugs. They may have limits on the amount of imaging and testing, or certain imaging and testing based off of a diagnosis. We support our patients with their insurance choices. Some of the issues that we have ran into, though, is patients have switched to a Medicare Advantage plan and didn't realize they switched. They thought they were changing their supplement. Well, it ended up changing their entire primary plan, and having to work through those conversations with our patients, or even some of the payments that patients have had on the back end that they weren't aware of with what that plan is offering them. Those are some hard conversations.
Yeah. Other questions? We have one here from Angelina.
Just so I understand what you're saying, is it cost less for them, and that's why people are choosing Medicare? About the payment for that, is that my question?
Lori, why do you think patients are choosing Medicare Advantage? I'll let you answer first.
100% the sneakers.
The sneakers.
The sneakers. No. I think the upfront cost is less. People are on fixed incomes. They don't think that a catastrophic disease is ever going to happen to them. That is kind of some of the stories I've heard from my own family and some of our patients. I can afford it on the front end, but didn't realize I would have challenges on the back end.
Yeah, so it does. It's less expensive, and there's lots of perks that they dangle in front of you when you sign up. You can get a pair of sneakers, you can get your gym membership, but what they don't realize is it limits the doctors you can see, and that some of your doctors may be out of their network. The way that Medicare Advantage works is an insurance company's Medicare pays the insurance company a certain amount per member per month. Then the insurance company has to take that money and pay for the medical care. And that company makes money by taking in more money than they expend for the care. So they create some obstacles, including the requirement for pre-authorization. So if somebody comes in and has regular Medicare and has a symptom for which you do a CAT scan, if you have regular Medicare, you just schedule the CAT scan, they get it done. If they have Medicare Advantage plan, you have to get authorization. They are allowed 3 to 4 days to tell you yes or no before you can schedule it. And everything you need to have done requires authorization, which requires extra time. So the two biggest disadvantages to patients is care is delayed because of the need for prior authorization. And second, not all of your providers that you currently see or that you might want to or need to see in the future may not be on the care panel for the Advantage plan that you have signed up for. So yes, the reason that people sign up is it's less expensive initially when you're signing up. Some of the disadvantages is the number of doctors or the doctors you want to see may not be on the panel. And second, there can be delays due to the prior authorizations. Other questions? Yes, Kevin.
I was just going to point out that between Medicare and Medicare Advantage, well, Medicare Advantage is marketed much more aggressively. I mean, some of these bells and whistles, here's $1,000 for your dental care, here's $300 for glasses, here's $600 if you want to buy some golf clubs or go skiing. I mean, it's just crazy. And that's in Iowa, and I think in some states, I hear like Florida, they might even buy you dinners every week or something.
Yes, good point. So regular Medicare is the federal government, and the federal government is not out there advertising for you to keep regular Medicare. Medicare Advantage plans always have an intermediary that is trying to, they're trying to keep their members healthy, but most of them do have a profit motive and a margin they need to make. And that's where there's a little bit of conflict between providing the care seamlessly, quickly, and making some revenue over the intermediate of what comes in and what goes out. Other questions for Lori?
I do have one
Another
more.
question, Poon?
Yeah. Do you find, since you have such a large elderly population, that women come in for their mammogram or other type of scans?
Sorry, are you asking whether people get their screening on a
Yes.
regular basis?
Yes. Yep.
How is your screening? So there are 5 different cancers for which we have validated screening, and we try to keep track on how good we are for individuals getting their mammograms, their colonoscopies, their lung cancer screening, their pap smears, their PSA tests. Do most of the individuals who see primary care doctors in Carroll, are they all part of your health system, and are you able to track that data?
We have 2 primary care groups. St. Anthony is one of them, and we do work closely with the other group here locally. And I feel like our patients who seek primary care are good about getting their screenings. Women, I know mammograms are one of those things that we're talked about for a long time as we age, and women for the most part in our area I feel are very good about getting their mammograms. One thing that we did start here at St. Anthony about 7 years ago was the CT lung screening program, and that was really an initiative pushed by our primary care doctors wanting that program available. So we see a large population in our area getting the CT lung screenings done, along with their colonoscopies and skin checks. I would say for the most part, the patients in our area are compliant. If they're going to see their provider, they're going to get the screenings that their provider would recommend for them. But getting people back to their provider for their routine checkup is, I think, something hard for everybody to get back into.
You bring up such a good point, and that is, we as cancer docs push the screening, but I think one of the biggest health measures is for individuals to have a primary care doctor
Mhm.
that is a teammate who's going to advocate and keep track of things. In our health system, throughout Des Moines, there's often been a little bit of a revolving door as doctors switch from one health system to another health system. And some patients are having a hard time keeping a primary care doctor
Mhm.
for years at a time. Are you finding that in Carroll, or do you have physicians who come and just are dedicated and stay for 30-year career, or are you having primary care doctors come and go and making it difficult for patients to have an ongoing um, relationship with the same primary care doctor for years or decades?
We definitely have the decade doctors. We have the providers that started their career in Carroll and have retired their career. And we've been lucky to have a group of young physicians come into the community to want to raise their families. Some of them have roots in Carroll. And that's always one good thing to look for when we're recruiting providers is what brings you to Iowa? Why are you coming? Why are you looking at Carroll as a place to practice and grow your practice? And a lot of times they have connections. They have connections to rural Iowa, and that's where they want to be. And then when we have the opportunity to share our organization and the resources that we have, it hopefully is a selling point for them to want to come and be in a community practice to support and stay in those practices.
Yeah, Carroll is such a great community, a caring community, a clean, beautiful little community, and in a beautiful part of Iowa. So I could see why it would attract someone who has a family, wants to be a part of a welcoming community, and not only have a career but raise a family there.
Mhm.
Well, Lori, thank you so much for being our guest. And I've always enjoyed my visits to your center and to Carroll, Iowa. And I appreciate you being our guest tonight, and also appreciate your support. Both Lori and I are on the board of directors for the Iowa Cancer Consortium, and so we get to work together in that capacity as well.
Well, thank you, Dr. Deming, and everybody on the call tonight. And I appreciate your partnership and everything that you do for healthcare and cancer care across the state, and really being an advocate for the amazing care that each one of us strive to provide every day.
Well, thank you so much. And if anyone watching this knows someone that might benefit from watching this program, it will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel, and also at the Mercy One Cancer Center website. I hope you'll join us again next week for our cancer education series. Thanks, everyone.